Now, once the blood leaves the capillary bed, now it's going to move into venules. Those are going to merge together to make bigger veins, and we're going to eventually dump back into the heart. So we say venules are formed when the capillaries unite together. And we call postcapillary venules, we say these are the smallest. As they merge together, we get bigger and bigger vessels. Postcapillary venules are really porous, so they're still going to allow fluid and white blood cells back and forth between the vessel and the tissue. Again, they have a very thin wall. So they have the endothelial lining, and they might have a few parasites to help to anchor the vessel in the area, just like capillaries, but they still have a really thin wall, just like capillaries. Now, as they merge together, they're going to create veins. Okay, so these are formed when venules converge. The difference, though, between a vein and an artery, again, is that veins have much thinner walls and much larger lumens compared to an artery. And again, this has a lot to do with pressure. They have a lot less pressure in them. So the pressure in venules is much lower than what we would find in arteries. Now, sometimes we call our veins capacitance vessels. You can also call them blood reservoirs, because your veins can hold up to 65% of your blood supply. So they can hold a huge volume of blood. And normally, though, they're only partially filled. This should make sense because veins have a really thin wall. They have the ability to expand and fill up a lot more. Okay? So they can hold a lot more blood. So this is just showing you the proportion of blood throughout your cardiovascular system. So we can see our veins and venules, they're holding about 60% of our blood volume, where arteries and arterioles are only holding about 15%. And you can see capillaries are holding about 5%. Now, within the cardiovascular system, your heart's going to hold some blood, and then also the vessels leading up to your lungs are going to hold some blood. Let's talk a little bit more about veins, because again, you know, the drawing that I draw out for you like this, and this time we're only looking at the systemic circuit, right? Blood leaves the heart through arteries, the left side, and it goes to your body, and then it comes back to the right side, right? And remember, when it leaves the heart, it's at 120. When it gets down to your capillary beds, we're down to about 35. On the other side, we're down to about 14 or 17. And when we get back, we're at 0. Okay, so again, I want you to remember that on that venule side, the pressure is really low. It's around 14 or 17 up to 0. So it's very low on that side. So what's driving the blood back to the heart are some adaptations that we find in the veins, okay? Because they don't have the same amount of pressure that arteries do. They're farther away from the pumping action of the heart. So we still have to have other ways to get the blood back to the heart. So one thing is having a really big lumen in a vein is actually decreasing the resistance. It's letting the blood flow easier. Also, there are valves. We call them venous valves. There are valves, just like you find in the chambers of your heart. There are valves in your veins that prevent blood from flowing backwards. So that means that as the blood moves through a vein towards the heart, it can't go backwards. You find these most often in the limbs, so in the legs and in the arms. And then lastly, our venous sinuses. These are really flat veins that have really thin walls. A good example would be like the coronary sinus that we find in the heart that is draining the heart and putting that blood back into the right atrium. So this is just showing you veins, and it's showing you moving from a capillary, which is microscopic, to a venule, to a vein, larger veins. Now, there are conditions called varicose veins. These are when veins become dilated. Now remember, veins have much thinner walls. They do not have a really thick tunica media. And so what can happen is, I told you that there are valves in your veins that prevent blood from flowing backwards. Sometimes the valves can become incompetent. This is most often going to happen in the lower limbs, especially veins that are more superficial. So a lot of times, I know, Brittany, you asked me, a lot of times arteries are much deeper in the body to be more protected. Veins can be deep, but we also have veins that are more superficial. Anytime you have a more superficial vein, it means that it is less surrounded by tissue because the wall is really thin. If a valve doesn't work and the blood flows backwards, it can pool in a vein and the vein's going to start to bulge. That's called a varicose vein. Most often it happens in the legs. The reason it happens in the legs is because of all the blood in your legs and having to push that blood against gravity. So especially for people who just stand. So like surgical techs and surgeons, if they're doing a long case and they're just standing in one spot, the blood can pool. So this is why a lot of times surgical techs and surgeons wear support hose. They wear support hose to suck everything in because, again, a superficial vein doesn't have a lot of support to it. So they're going to try to add some support there. Other things other than prolonged standing that can cause varicose veins: heredity. If your grandma had varicose veins, your mom had varicose veins, chances are you're going to have them too. Obesity, pregnancy. When you are pregnant, your blood volume will double and it has to go somewhere. And remember, I just told you, let's go back here. I just told you that your veins act as a blood reservoir. So the more blood you have, your body's going to put it in veins. So when you're pregnant, it is not uncommon to get varicose veins. And then also elevated pressure. So pregnancy, having a baby that puts a lot of pressure in the abdominal pelvic cavity, or even constipation. If you can't go and you're sitting on the potty and you're pushing really hard, it causes a lot of pressure in the anal canal, and it can result in varicose veins in the anal canal, which are called hemorrhoids. This is what you normally think of when you think of varicose veins, right? These are in the legs. These are those bulging veins. And so what you see is you see a normal vein. These are the valves that prevent the blood from flowing backwards. So if blood should be only moving this way towards the heart, right? And if blood tries to go backwards, that valve is closed, it won't let it. But when you have a varicose vein, it's usually from pressure. So again, pregnancy is really common because you have so much more blood volume and it causes these valves to not work, and blood is allowed to flow backwards and it will start to pool in an area. So you can see here, again, what makes these much more prone is the fact that the wall of a vein is much thinner than an artery, but also you're going to see these in more superficial veins where they have less supporting tissue around them. Okay, so in the leg, I did not put a picture of hemorrhoids up here. I figured y'all did not want to see that at 11 o'clock in the morning.
I do want to see what it looks like.
You do? Well, you can Google it. I feel like our IT people already think I have like every STD under the sun because I Google all this stuff to put pictures in. So I'm probably like, what is up with this Pew girl? She's got all kinds of things. Now we do have something called anastomoses. I'm going to star that because you're going to see that term. An anastomoses is just where blood vessels connect together. That's all that means. We have them in arteries, arterial anastomoses. These are just going to allow alternate pathways to feed a tissue. We call them sometimes collateral channels. These are really common in joints. They're common in the brain. We have an area in our brain, it's actually called the circle of Willis. So remember, you guys, you have a right and a left common carotid. That's going to feed the brain. If something happens to one of your carotid arteries, I have a friend whose carotid artery exploded. It's called a dissection. She had a stroke, but thankfully her right side was fine and you have a circle of Willis. So her entire brain was still being fed. So she has no deficits because her brain was still getting perfused. That's an arterial anastomoses. So you have them in your brain, you have them in joints, you have them in your heart. And it just means that if blood supply is blocked in one branch, the collateral channel will supply that and feed that tissue. However, you do not have arterial anastomoses in some places, like there's none in the retinas. So people who have retinal strokes, where they get a blood clot that lodges in the vessels that feed the retina, they will go blind from that. This is very common in people who have diabetes, for example. A lot of times they'll lose their vision because those vessels will get damaged. There's none in the kidneys and there's none in the spleen. So again, in these areas, if blood supply is blocked, the cells will die. You also have anastomoses in arteriovenous areas. So this is basically going to be in the capillaries. Now, if you look at a capillary bed, so if we go back to this picture of a capillary bed, you can see really well when you look up here, you can see all those anastomoses, all those different pathways to the capillary bed. So those are really common. And those are called arteriovenous anastomoses. And then last are venous anastomoses. These are also really common. And so this is why an occluded vein usually does not lead to tissue death. You may have some pain in the area, but it's not going to cause your tissues to die. The only one that really causes problems is the arterial anastomoses.